Welcome to today's episode of Earth Talk Show. I'm your host, Lucy Wanza Kariuki, and today we are going to discuss something which is going to interest you as our viewer. It affects everybody. You may be having it right now. Today we are talking about asthma. We've seen many people suffer from it, a familial tendency in our families, but today I have beautiful guests in the house who are going to take us through the topic. And I have the pleasure to welcome them to the show so that they can kindly introduce themselves. We are starting from the near end to me.
Okay, thank you, Madam Lucy, our host today,
Yes.
and the GBS studio for giving us time to be in studio today to talk about this issue about asthma, which it affects many,
Yes.
and many people need to know how to go about it. Yes.
Next.
Okay, thank you, Madam Lucy,
Yes.
for the opportunity and GBS to come to discuss about asthma. It's a condition that we interact with it day in, day out, through the night, through the day, from a young age to the adulthood, and it will interest our viewers and even us in the studio as we discuss about it.
Yes.
Thank you for the opportunity.
Thank you so much, our guests, for your introduction. Now we are going to get into the topic, asthma. Mr. Omito, kindly tell our viewer what asthma is.
Yes, thank you. Asthma is a very common condition, and it affects many. Asthma is more of your body reaction towards some environmental stimuli or allergens, which affects your airway.
Okay.
And it affects people differently. Some, they may have severe symptoms, some may have mild. Yes, and then you have overreaction of your airway. It's
When
an
you talk
airway
of
disease,
airway,
yeah.
what are you talking about?
Your breathing system.
Yes.
Yes.
What does it entail? Where does it start? Where does it end?
Okay, the
Yes.
air, when I'm talking about the airway,
Yes.
I mean how you breathe. You take in air through your nose or your mouth into your trachea and then into
Windpipe.
your lungs. Yes,
Into the lungs.
into the lungs
Okay.
and out. So that system.
What
of the
you want
lungs,
to
yeah.
tell us is that anything outside that airway, and even if it is a reaction, is not asthma. Outside
Yes,
the airway.
asthma is actually on the airway.
Yes.
Yes.
And
yes.
how can we say that asthma is distributed either in our country or worldwide? Like, how many people do we expect to be having in a population?
Approximately a third of the population
Yes.
that is affected by asthma. But in the recent trends, it shows an increase of the age between 12 to 24.
12 years.
Yes, 12 years to 24, there is an increase of the trend. And we can say there is no discrimination from young age to the adulthood. Any population, any age, any range, you can get an asthma.
It doesn't discriminate.
It doesn't discriminate.
Okay, Mr. Omito,
Yes.
can we say that there are types of asthma?
Yes, we can classify asthma according to maybe the origin or there is severity.
Okay.
Yes. So when we talk about the origin, we talk about intrinsic and extrinsic factors that the cause, the causative. Yeah? Yes. So, and about the severity, then there is 4 classes on the severity, where we talk about the intermittent, we talk about persistent, mild, persistent, moderate, and persistent, severe. That's how asthma is classified internationally. Yes.
Bring it home now to the viewer who will not understand persistent, this one, and intermittent, such kind of a language.
Okay.
Yes.
When I talk about intermittent, intermittent, this is asthma that you get an attack less than twice in a week. We call that intermittent, just episodic attacks. When I talk about moderate, persistent, mild, then this is a person who get attacks like more than twice in a week, but not daily. Yes. And then when I talk about persistent, moderate, this is a person who get daily attacks, almost on daily basis. And then when I talk about the persistent, severe, then this is a person who is almost getting asthma 24 hours, yani throughout the day. Yes, I mean that.
Okay.
Yeah. So that's how it is classified internationally for ease of management. Yes.
And I was asking myself one question. He's talking of attacks. Like, what are the signs and symptoms of this condition of asthma so that I will know that what I am having is asthma?
Okay, the classic sign is a wheeze. You get a wheeze. The other sign is a cough, then shortness of breath. There are three typical signs. That is a wheeze, a cough, and shortness of breath. But those are the typical signs as a client or as a person you will identify with. The other one is chest congestions. The chest feels heavy and you feel like you can't breathe. Yeah, those are the typical signs.
Wheeze.
Wheeze.
Yeah, what is this you're calling wheeze?
Wheeze is a sound
Yes.
meant while breathing out. It's brought by the lungs. The lungs airways have been inflamed, the airways have been inflamed, and then they have swollen, so making the airway very small. So it makes it difficult to breathe out. So you produce a sound.
So now that airway is an hollow,
Yes.
something like a pipe,
Yes.
like a straw, which we use to take soda.
Yes.
So when it gets swollen, it becomes smaller.
Yes.
And now the air is fighting its way in. So at that particular point is when we are describing now what you're calling a wheeze.
It's the other way around.
Yeah.
The way highway is hollow,
Yes.
then it becomes small because of swelling.
Yes.
Then breathing in
Is okay.
Is okay.
Yes.
But because there is a lot of air down in the lungs,
Yes.
so breathing out, you are squeezing the air to come out. And
Yes.
because there is difficult, that's you produce the sound. Yes.
Maybe
Yes,
I can
Omito.
try to simplify to
Yes.
our viewers to understand.
And also
what
for
we
the
call,
host.
Yes, to understand what this wheeze is.
Yes.
Wheeze is that whistling sound that when a person has asthma, when you are trying to force...
Whistling.
Yes.
Like,
Whee.
yes.
Yeah. It's like a whistle blowing in your chest.
A musical
When you are-
sound.
The one
Yes.
we blow when we are doing the traditional dances.
Yes.
That
A
whistle.
musical
Yeah, so
sound.
Yes,
that
musical
kind
sound.
of sound when
Yes.
somebody is trying to force breathing forcefully.
Yes.
That sound that is being produced like a whistle, that's what we call wheeze.
Yes.
Yes.
And I thought that is the only thing that I will get from that particular person who has asthma. But you've added two. So you said there is wheeze, there is a cough, and now
There is difficulty in breathing.
difficulty in breathing.
Yes.
You find it hard to breathe.
Yes.
It's like you are anchoring for air.
Yes.
Yes. So when that person comes in, and you as a clinician, you are a clinician,
Yes.
and you are in your office or in your place of work, can you tell from a distance if that is asthma or not?
Yes, you can tell from a distance.
From a distance.
Yes.
Which means this musical sound is loud.
Yes.
That is it.
Yes.
But we've seen a situation with, let me call them, not to discriminate them, but schoolgirls, teenagers, adolescents. There is a sound they produce as they enter the walkway to your clinic, and as you sit, you can say, that is not asthma. So how do you differentiate?
The differentiation...
And they also do physically. They try to breathe like someone with asthma.
Okay, the main differentiation is that, one, the music of sound can be heard audibly, and still, when you examine, you can still examine and hear the musical sound in examination and even audibly. Two, for the differentiation, for the schoolgirls, you hear the musical sound is both ways. While breathing,
In and out.
In and out, exhaling and inhaling.
Yes.
So there is a difference, because for asthma is the forceful expelling of the oxygen, of the air in the lungs, that is difficult.
Yes.
Yes.
During the vital signs that you people take in the hospital,
Yes.
without the whistling sound, suppose it is not very serious, what abnormality will you be able to tell?
Okay, in examination,
Yes.
cardinal examination, let me say the vital signs, that is the pulse
Yes.
and temperature,
blood pressure.
yes, and even the oxygen.
Yes.
There is no cardinal signs you can pick from
the vital signs.
Yes, there might be normal vital signs.
Yes.
But the cardinal sign to know this person has difficulty in breathing is through the examination of the chest.
Yes.
And even the examining the client through, we call thrometer. You give the person to blow air out to know if he's able to blow the air out. If the client is not able to blow the air out, you know there is a problem in the lungs. Yes.
So,
Maybe
yes,
I can add on something which my colleague has said.
Yes.
Depending on the severity, if this person has got a severe attack, then sometimes you can find the oxygen level, oxygen saturation in the blood goes down. Yes, because of the severe blockage of the airway. And because of that, you'll find also the pulse rate will increase, because the heart will also tend to beat more faster to supply the little oxygen in the blood. So those ones can also be picked through taking the vital signs. Yeah.
So there is no any other condition which shares the musical sound with asthma.
Okay, pneumonia shares, and mostly in children.
Okay.
Yes. In children and even TB. In children, because of their development and the lungs have not been fully developed.
Yes.
And because they are risk of getting frequent infections, you find they share some cardinal sign. And one cardinal sign is a wheeze, which is characteristic for asthma. It's shared both in pneumonia for children and TB for children. Yes.
But the main definitive factors or signs are those three.
Yes.
Those three must be there for you to say that this is asthma. Okay, now you've said it is allergic in nature.
Yes.
What are some of the precipitating factors?
Okay, the environmental factors,
Yes.
like people living where there is a lot of pollution. Where there is a lot of pollution, those allergens, when this person who is allergic to them inhales them, they cause that inflammation in the lungs. Another things that can predispose people to asthma is immunological factors, just the nature of your system, the way your immunity works. Another one is hygiene.
Hygiene.
Issues to do with hygiene.
Yes.
We call it the modern cleanliness. Yes. This modern cleanliness, these are, let me take for example in somewhere in, like where we are here in Nairobi, someone who lives in those big flats, you live in the 10th floor up there.
Yes.
This child is born and brought up there. The environment is very clean. Very clean.
There.
Has never been exposed to any dust or any these other things that are in the environment. So this person, where he grows up, there's no those things that can sensitize his body to develop immunity against those allergens. So the moment this person will get exposed to some of these allergens like dust, like pollen, like cold, like he overreacts or she overreacts. Yes, and then causing those symptoms of asthma.
Okay.
Yes.
Yes. Anne, is there a difference between precipitating factors and causative factors? Or are they the same?
No, they are not the same.
Yes.
The causative factors are the factors that cause the
Which make it
infection.
to appear.
Make it to appear.
Yes.
Predisposing factors, they are factors that you are predisposed to, you are exposed to.
You
by
are at
either-
risk of.
You are risk of, you are
Yes.
exposed.
In short, with this, anytime you can get asthma.
Yes.
Yes.
But without it, you cannot get.
Yes.
But causative with this, I can get it direct. Yes.
What are they, the causes?
Okay, we can say first, like we say the predisposing factor, what he has said. I can say the classification, the extrinsic, they are the outside causes. And one of the outside causes is from the family. A family with
So when you
atopy.
talk of outside, it is outside the body of
Outside
the person.
body of the person.
Okay.
Yes, from the environment, from outside you. And one can be even extrinsic from your environment, your hereditary, what is in you, what was born. And one is the atopic. Somebody with atopy, with history of atopies like eczemas, it's very easy for you to get asthma because it's a small trigger, maybe from pollen grains, and it comes out from outside, and you get the exposure. From inside, that is maybe you are already immunocompromised. And because you are immunocompromised, your body already immune system is weak. And it can't fight any predisposing. You get a certain infection, a small infection, it will trigger out what is inside you. It will trigger the asthma or the reactions in your body, and it will bring out the asthma.
Yes.
Yes.
Yes. So it has to come at some point.
Yes.
You had no history, but now it has started. You talked of asthma, which can last for 24 hours.
Yes.
How do those people survive
Those
in
people-
terms of normal activities of daily living? And when we talk of those, we are talking of things like breathing, excretion, that is passing out of the normal things that we don't need in the body. For example, breathing. It is a normal daily living activity. How do
Yes.
they survive?
Okay, for this person, as you can, as I had classified it, for the persistent severe, this person who has a attack which lasts almost the whole day, these people, you'll find that life for them will be very difficult because these are people who need even to be put on oxygen.
Yes.
Their daily activities will be interfered with because they can't work with that congestion. So these are people who need serious medication, and they'll be even admitted in the hospital and put on oxygen. So definitely this is a person who is very sick.
They really need a lot of help.
Yes.
And are they on medication like throughout?
Yeah, they'll be put on medication until the attacks is controlled, for them to be allowed to go out. At least those the congestion, the chest is cleared, and the person is taken care of. And if not taken well care of, this person can even die because of the congestion in the chest. So these are severe disease in this stage.
In this stage?
Yes.
Okay.
Yeah.
Viewer, this is GBS TV Africa. You're watching Health Talk Show. We are going to continue after the break. We are continuing with Health Talk Show, and we are discussing about asthma. We've had very interesting facts, like it doesn't discriminate, it affects your airway, it comes at one point in time. But now, how do we manage it? That is where we are. Anne, kindly tell us, how do we manage asthma?
Thank you for the welcome.
Yes.
Okay, management of asthma is dependent with the severity of the asthma.
Yes.
Like the moderate, we can say sometimes the moderate, mild, intermittent, and severity. The management is different.
Yes.
Depending on which type you have. For the intermittent, when you get 1 episode or 2 episodes in a week, we manage it with just the controller.
Yes.
We make your body to accept, mostly we use inhalers. The inhalers, we have 2 types of inhalers. We use the corticosteroids and we use the salbutamol. The salbutamol is a reliever. Mostly when you have an attack,
yes,
you use the salbutamol inhaler to relieve the symptoms. But for corticosteroids inhalers, they control the symptoms.
Yes.
So for corticosteroids, the control is used throughout.
Yes.
And salbutamol is used when you have the attack to relieve the symptoms.
Yes.
So a good use of the corticosteroid, you control the cause. And 2, there are different types of corticosteroids. We have the short-acting and long-acting. The short-acting is for short duration. The long-acting are for long durations. Still depends on the type that you have.
Yes.
If you have, we say, intermittent moderate, we will use long-acting corticosteroids and still will integrate with other types of levers. Either inhaled, we are using inhaled, either tablets to control the asthma.
Yeah.
For the severe, you have to be admitted in an hospital because there are other comorbidities and there are other things that we have to control. Because 1, the oxygen is very low, we have to put you in an oxygen. 2, because the lung is congested, you are prone to infections, bacterial pneumonias. So you have to be put on medication for other infections that may come in because of the congestion of the lungs.
Okay.
Yes.
So there is the general and specific management.
Yes.
That is, if it is the cardinal signs that we talked of,
Yes.
you give these medications.
Yes.
That is why you are talking of inhalers.
Inhalers.
Because we've seen people with inhalers.
Yes.
Now, in that part of management, before we move to the next point, if I may ask, we know that this person does not live alone. Sometimes you may forget. You clinicians, do you make your patients aware of what they take? And also, what is the role of family or the social networks around the person?
Sometimes it's good for a patient with asthma to be accompanied by a caregiver.
Yes.
Because
To the hospital.
To the hospital.
Yes.
Because when you come and we diagnose you with asthma, you have to go a teaching process.
Yes,
We teach you how to use the inhaler, one-on-one. So you do practical until we tell you you are okay to go on with an inhaler.
Yes.
If you are unable, we prescribe something called spacer. It's an object used to enable you to breathe normally, the way you breathe normally, as you breathe your inhaler in. So we have to teach, to examine you, to know if you are able to use it normally. And because we have different types of inhalers, modes of inhalers, so we see which one, we examine which one is suitable
for you.
Yes. Yes. And to the same information we lay it to the caregivers, so that when you are at home, they can assist you to take. And when they see the symptoms also are severe, they will help you to come to the hospital. Yes.
I've seen someone falling down on the road, and what was in the pocket of that man was a card written epilepsy. For asthma, do you advocate for such? Because it was a clear indicator that this person undergoes medication for epilepsy, is epileptic. So even we felt that, wow, this was good. Because even on arriving to the hospital, because you've already collapsed, something can be done to you, even before you wake up, to tell us what is the problem.
Okay, for the regular medical checkup, sometimes the alert cards are good, and so we indicate which allergens you are allergic to, which trigger asthma.
Yeah.
Like if you are allergic to, let me say, protein, you indicated there you're allergic to certain things, you're allergic to a certain drug. The allergic card is to alert you you're allergic to something. But we still have a problem. Yes, today you come, we've written an alert card. Tomorrow you come afresh as if we've never attended an hospital.
You give a lot of work.
Yes, you find it's very hard.
Yes.
To know if you've been in follow-up. So we still have challenges with carrying out our medical documents.
Maybe you will tell us later if that is ignorance or we are used to your good talk until we don't know when it is serious. Omito, kindly let us know one thing. You've said that these are attacks.
Yes.
The fact that you are asthmatic, you may be well for 1 year.
Exactly.
You may be well for 1 day, and the next minute you are under attack. When is that particular point for an asthmatic patient before he or she goes to the worst? When is the best moment to see the doctor?
Thank you for that question.
Yes.
Before I answer you, maybe I wanted to add some input on what my senior colleague here has just said about the treatment. As we've said, the treatment is according to how you've been classified. The intermittent, the persistent, mild, persistent, moderate, and persistent, severe. So the preferred medications for the attacks or for the asthmatic attacks is the inhalers, because the inhalers only work on the lungs only, on the airway only. Different from the systemic drugs that works in the whole body, but it will depend on the severity of your attack. So you will be given treatment accordingly to how you've been staged.
Mm.
So I think that is good for our viewers to
to
know
understand
that and to understand that
local medication is the best.
Yes,
which
that
goes
works just on the
straight
yes.
and
So
specifically, categorically in the airway.
exactly, because some of our viewers they sometimes tend to think that when you have been given the inhalers, then you are more sick.
Oh,
yes,
yeah. In
I've
fact,
seen that.
That was my next question.
Yes, when you give them inhalers, they think now this person must be very, very sick.
Very,
but
very
the
asthmatic.
inhalers are the preferred
Yes.
treatment. We have different inhalers, as my colleague has just elaborated. We have the short-acting. We have the inhaled corticosteroids. They're the best preferred for the treatment of asthma, according to which stage you are.
Okay.
Severity of your, yeah.
Thank you. Thank you
And
for that
then,
input. Now,
yes.
yes.
We try to, now back to your question.
Yes.
We try so much to empower our patients. Asthma is something that you can control. We don't need to interfere with our patients' lifestyle and activities every now and then. You have an attack and you are running to the hospital. So we try so much to empower them. And the goodness, when we give them the inhalers, and we have empowered them, and they know more about the signs and symptoms of their diseases. So when they start feeling that attack at early stages, before it goes to that extent that now you can't even breathe, when they do the inhalers, they use their inhalers, and then they are good to go. They don't have to come to the hospital.
So what you're trying to tell us is that asthma alerts somebody.
Yes,
on the way coming.
Those people who have had it for long, they'll start knowing the symptoms early. When they are exposed to something that triggers their reaction, they'll start knowing it. Maybe you've just gone somewhere where somebody has sprayed very strong perfume. You'll start feeling that irritation in your chest.
Yes.
And a lot of secretion and maybe coughing before you go further into feeling that tightness and difficulty breathing. So in that early stages, you can just use your inhalers and you are relieved. But when it comes now to moderate, that is mild, we can say that is mild attack. That is intermittent and persistent, mild. But when now it comes to moderate, where you have attacks almost daily, then at that point, you need to see your doctor.
Okay.
Yes.
There are times when we've seen people blaming themselves. For example, I remember there was one parent who lost a child. The girl used to be in the university. Then they had sprayed some things in the house, like, what do we call them? The fresheners? Air refresheners. Then they didn't know that their daughter was coming. And that is how she got this severe attack which killed her. And who is to blame?
Let me say there is nobody to blame, because as we said first, like what we said, because of the predisposing factors. One of the predisposing factor we said is the modern, mostly the urban cleanliness. You find that you are disposed to cleanliness, to freshness, to air conditioning of your house. And then one day maybe wind blows and the whole house is full of dust, and then you are there, you're exposed to dust. The first thing, because you will be the response system in your body, because it's a fallen organ in your body, it will respond. And you'll get what we say is an asthma attack, a severe asthma attack. And asthma attack, it is a combined, we say it's a combination of all the systems in the body. The heart is working hard to pump the blood, then
Yes.
our lungs are working hard to remove the extra oxygen out of the body. The body is responding, you are coughing. So you find the whole body is in
a
agony,
crisis.
in a crisis.
Yes.
And then too, it depends still. You find you've got it in, and then the distance to the next response to a medical facility is far. You find there is a lot of difficulties, and because the body is in shock, you find the response to the body self to heal itself becomes a problem.
Yeah.
So you can't say it's the parents to blame, or this the child to blame because of that. But true, you never knew that your child is coming. So you never prepared yourself not to spray. And two, you want freshness. So
Yes.
you can't blame yourself. And sometimes things happen. You find you are okay, and all of a sudden somebody passes your way, and somebody never knew you are an asthma person. Then passes, and you are allergic to that spray, and you get an asthma attack. You can't blame.
Shortly or in very few seconds, diet. We need diet to be healthy, as he tells us in a few seconds about exercise.
Okay, diet. We say balanced diet is required in everybody's body,
Yeah.
and mostly
Not only in asthmatic
not
case.
only in
Yes.
asthmatic,
Even
but
in a healthy person.
even in a healthy
Yes.
person. So because the body system as was built, it requires all food, the body building, it requires the protective, it requires the fruits and vegetables and
Fats and
grains
oils, water.
and fats and oil. Everything is required.
Minerals.
Everything is required, the minerals. So for the asthmatic patient, we still recommend the balanced diet.
Yes.
You have to eat all the combination of food. You have to eat the carbohydrates, the proteins, you have to eat the vitamins, you have to eat the minerals, the fruits, the fat. They are all required, but as moderate. And if your body system, we examine you as clinician and find you really need a nutrition, we will
Yes.
refer you to the nutrition.
To take the journey.
Yes.
Thank you. You said that at the end of the day, the body needs exercise. For this person, which exercise do we recommend?
Yeah, thank you. I will also add something a bit on nutrition. The patients we are seeing mostly, or this disease, the way it behaves, we have no nutritional restrictions on the food. What we recommend is the balanced diet, unless this person has got some allergy to some of those food. Then we can recommend that he or she stops taking that food, because it can trigger the reaction on the body. But otherwise, they can just take the normal, the usual diet, well balanced. Is good for them. When it comes to exercise, depending on the severity of your asthma, then because there are this group of people who also get attacks when they do exercise, especially somehow straining a bit.
Yeah.
So when they strain a bit, maybe they have run, sprinted for a few meters, then they start having that asthma attack. You hear them wheezing, you hear them coughing, So we advise just do, for that person, we can just advise do small exercises like walking, things that won't trigger the reaction in your body. For those who don't have problem with exercise is good for your body, and it is very much recommended to do exercise like jogging, like playing other things. If you can play football, if you can do that, it's good enough. And for those people, maybe you get those attacks when they do maybe some strong exercise. We can recommend, if they know themselves, if they know their health well, then they can use the inhalers before maybe if it's sprinting, you're going for sprinting, and after sprinting, you get that attack. You can just use your inhaler before.
Mr. Omito,
Yes.
I'm not cutting you short, but viewer, this is GBS TV Africa. We are going to start from there after the break. Yes, viewer, we are discussing about asthma and exercise. Paradox. They look like they can never meet, but Mr. Omito is here. Kindly continue.
Thank you. As I was telling my viewers earlier, before we went for the break, there was these people who, when they do a certain exercise, they get the attacks. So my advice to these people is that if you are you have your inhalers, then you can use your inhaler before you go do the exercise.
Yes.
For example, we have like footballers. You might be a footballer, and when you do that, maybe when you go to the field, you get those attacks. So you can use your inhaler before you go to the field. That's the kind of advice we're trying to give to our asthma patients.
Is this
or
not
empower
risking
them
your
with,
life?
empowering them with that
Mr.
information.
Omito, is this not risking yourself as a patient?
Not really. Yes, as we had said earlier about the inhalers, we have the controllers and we have the relievers. So when you have your controller inhalers, which control the asthma, you can use it before.
Which puts it under fit.
Yes.
Such that even to get an attack becomes history in that person's life.
Exactly my point.
Wow. Anne,
Yes.
what are some of the myths and misconceptions that the society, some tribes have towards asthma? Because one I was trying to get is what Mr. Omito said. I think it's you, I don't know if it's you or him. If we see people with inhalers, there is what comes into our minds. What are these myths? Because I think that is one of the myths that I would request you start with.
Okay, one of the myths is that when you're given an inhaler, you have a severe disease and your asthma cannot be cured. And
Yes.
cannot. Asthma is reversible. You might have asthma, but because of consistent use of, let's say, the controllers, the inhalers that control the asthma, you find you can live your daily life without any trigger.
Yes.
So that is a myth, because after being diagnosed, the inhalers, they are the medication that you use directly. They go directly to the lungs, and they help you, at least the lungs open up, and they control even the inflammation which bring the asthma.
We have seen viewers in our communities who start digging graves for their relatives because of inhalers. Kindly, we are trying to control. We are not saying someone is dying. Yes. And
Okay, let me say this. One, because one being diagnosed with asthma to some community is like a death diagnosis, because maybe through the history they have said, my relative, my grandmother had asthma, died. My auntie had asthma, got an attack and died. And now I have. And I have gone to the doctor. And now I have an attack.
yes.
So we want to demystify their myths. Because when you come, you have an asthma. We take you through health education and education about the knowledge of asthma, how asthma comes, how you can control and prevent asthma, and even the medication. And then we have a clinic, how you can be reviewed every time that you have to see the progress. So when we see the progress, we encourage you to continue. Sometimes you find at the start you used to use twice or thrice the reliever. And as you continue, you see both the reliever and the controller. You find now the attacks have reduced. You only use the controller. So it means your daily life, there is no a time you have an attack. So we want to demystify that when you have an attack or you are diagnosed with an asthma, it's not a death sentence. You can live your daily life with asthma as long as the asthma is controlled and you are following the prescription and the advice, and both your life, the predisposing factors that bring to you the asthma, you have prevented them.
In short, and what we're trying to tell us, those are myths, those are not facts. You clinicians have the facts. As we come to the end of the show, Mr. Omito, kindly give us, in brief, preventive measures as you give your parting shot. Face your camera.
Okay, thank you very much. Our viewers, as you've said, asthma is something that is reversible. So you can get an attack and it can be reversed. We have the medicines that help us in doing that. So to our viewers, when you get asthma, please make sure that you adhere to what we prescribe for you and to control your asthma. And also, you should know, you should be aware of what triggers the attacks. So if your asthma is triggered by cold, try to always keep warm. Keep warm, wear jackets. When the weather is cold, make sure you keep yourself warm, wearing heavily to prevent getting that cold. If you know maybe your attacks is caused by pollen, sometimes during this month that there's a lot of pollen in the air, avoid your exposure, going maybe to the shamba or somewhere that you can inhale those pollen. If it is dust, try to avoid getting to dusty places to prevent getting those attacks. So to my dear viewers, asthma is very controllable, and health education is important. Just know what triggers it and try to avoid it.
Thank you so much. And your parting shot.
Okay, my parting shot about asthma. Asthma is can be got through our daily activities. For us is to know what triggers it and how can we prevent it. And if we have it, let me say like in the era of that we are in of COVID-19, we've got a reduction in the asthma cases. Why? Because of using a preventive measure. The mask has helped even the asthma patient from inhaling the foreign bodies that trigger the asthma. So if you know my asthma is triggered by maybe dust, I have a preventive measure now, a mask. It will help you to prevent. It has prevented, let me say, the most frequently respiratory infections recently. So we can still keep the mask. Is not for COVID-19, but let it be our daily activity to prevent some respiratory infections that we get during our daily. That is what I have for you viewers. I'm Anne Munyiva-Kasioki, a clinician.
And I'm Martin Omito, also a clinician.
Thank you so much to our guests. It was a pleasure having you in the show, viewer. This is DBS TV Africa. We were discussing about asthma. It's not a death sentence. It's reversible, it's controllable. I was your host, Lucy Wanza Kariuki. Till next time, bye-bye.